Good morning, everyone, and welcome to the assessment number one review. I was trying to get a blueprint from ExamSoft together for you. However, that's not possible for this exam, so I'll do the best that I can. I've narrated through these slides, so as you go through, you should, have a clear understanding of what to expect for our first assessment. Okay, everyone, we're going to go over just some general instructions for the assessment and what will be expected of you. First, I can't stress enough, please get to class on time. I know that you come by buses and parking is an issue, but please try to allow yourself enough time to get in and get settled. When it's 8:10, we're not going to be logging on right there at that point, but you do want to be there in enough time so you can get settled. You will need to use the computers that are provided by the School of Nursing. There is a laptop on every desk. So if you want to bring your laptop to take notes with after, because we will have lecture after the assessment, you may do so, but to access ExamSoft and to take to answer the questions, you will need to use the computers that we have provided. With that said, it's going to be very, very important that you have your ExamSoft username and password ready. If you do not know your ExamSoft username, if you do not have your ExamSoft password, please contact IT prior to the assessment starting, because it's going to be not fun if you don't have it. You're going to be stressed out. So make sure you have it and you have it written down. You might want to write it on a little piece of paper or something. Some people put it in their phones, but you're not going to be allowed to have your phones at the desk with you. So write your ExamSoft information down on a little piece of paper if you don't have it committed to memory. No one is permitted to sit in the back of the classroom along the wall. I know we have some regulars and that's kind of your spot, and it's okay. You can have your spot back after the assessment, but no one's allowed to sit there while the assessment is going on. There should be plenty enough seats, and I will help people spread out. Those first two rows on either side of the classroom generally are not used. So, spread yourselves out, and don't be offended if I get up, ask you to move to another space and spread you out a little bit better, okay? So that's what we'll be doing with spacing and where we will be sitting. Along the back of the wall, because there won't be anybody sitting there, everyone will need to put your backpacks and your coats and things. They all need to be back against that back wall. Please make sure your phone is turned off or the ringer is silenced so that your bags aren't ringing during the assessment, okay? There's nothing that should be at the desk except for you. That means no water bottles, coffee cups, juice bottles, all of that stuff that we have sometimes in the beginning of class, during lecture. None of that is permitted on the desk, just you and your computer. Again, no phones, and I will be checking for watches. If you have watches on, doesn't matter what type of watch it is, it needs to come off. So put it in your pocket or put it in your backpack until the exam is over. Again, no watches can be worn during the exam. Dress in layers so that you can be comfortable. Some people feel the room is a little chilly. Some think it's a little bit warm. For some, it fluctuates during the class time. So dress in layers. And by this, I mean, you might want to have stuff that you can take on and off, during the assessment. But you can't have hats on. So no baseball hats, no hats with the pom-poms, nothing like that, nothing covering your head, no scarves around your neck, no blankets. It looked like somebody had a blanket or a big giant wrap that sort of like one of those blanket wraps or whatever in class last week. I wanted to snuggle up next to you because it looked really warm in there, but you can't have it for the exam. When the assessment or the exam is over, you may certainly put your hat and gloves and your mittens and all that other good stuff on, but for the time that we're doing the assessment, no hats, scarves, blankets, big giant wraps, no gloves or mittens, and no earmuffs, okay? More instructions for you. Please make sure that you use the restroom prior to the assessment beginning. Once you leave the classroom, you will not be able to access the assessment again. So please make sure you've taken care of all of your, personal needs before we start. I know it's cold and flu season, and some of you have colds and sniffles. So if you need tissue or Kleenex, make sure that you have that and you have it out prior to the start of your assessment. Yes, you may have tissue next to you. I don't want you using your sleeve. So please make sure that you have tissue and that you have enough of it so that you don't have to get up and go to the bathroom. Pay attention to all of the instructions from IT. IT will be there with us in the morning. They usually walk people through. There's usually always somebody there who doesn't pay attention, gets kicked out of ExamSoft, has to get a new password, you name it. If I'm saying it, it's because it's happened. So please listen, pay attention, and follow the instructions so that everyone can start on time. If you have questions during the exam or during the assessment, unless it's something about the program in ExamSoft, I really can't answer it for you, okay? So questions regarding definitions or concepts or what does this mean or can you explain it a little bit better? Like that's not the time for it. And so I won't be answering questions like that. Apologies up front, but it's an assessment, right? I'm sure everyone knows this, but as we go through academic integrity, I just want to remind you all that cheating of any type will not be tolerated, and that people who are caught or suspected of cheating will have their assessments stopped, and you'll be asked to leave the room, and then you'll have to follow the procedures for the School of Nursing academic integrity policy. So please look at your syllabus. In the syllabus under academic integrity, there's a lot of helpful information there. And then you can also, there are some links, if you're looking at it online, you can link out to the School of Nursing as well as the university academic integrity policy. Please consider this your warning. So I know I won't have to speak to anybody on Friday, but if I do, that's the time for action because this is the warning. Please keep your eyes on your own computer screen. There's no reason to look on your partner or the person sitting next to you. There's absolutely no reason to look on their screen. Just, pay attention to where you are. Please do not talk. That means not at all. Don't talk during the assessment. This includes the time when instructions are being given. Sometimes there's little glitches and IT has to do stuff. That is not a time to talk. So please don't talk. If you have a question about something, you can raise your hand and someone will come and help you. So don't ask your classmate, ask me or whoever the other proctors may be. If your classmate is responding to you, if they're talking to you, if they're asking you questions, it would be in your best interest, please, to ignore them. Don't respond to your classmate because then I don't know who started the conversation or whatever. You're both in trouble for talking. So just don't talk. And if you find that someone is cheating off of you, please let a proctor know, because complicity is also a crime, right? So there may be someone cheating, but if someone's allowing this other person to cheat off of their paper, then they're just as guilty as the person is who's cheating. So, if you think someone's eyes are wandering on your paper, or, they're cheating off of you, please let me know, or somebody else. So, yeah, that's all I'm going to say on that. Now, for the assessment protocol, that means what are we going to do with this thing? Once the assessment begins, again, I can't stress enough, please remain quiet. And when you've completed your assessment, you can quietly exit the room, all right? Don't stand in front of the classroom doors, because even though it may be you and a friend who are whispering, if there's 10 people outside whispering to their friends, that's 20 people whispering, and it gets really super loud. So please be courteous for people who are still taking or completing the assessment. There is, most of you probably already know this, but there's a student lounge on the 4th floor. There's snack machines, comfy couches, places to chill out. So you can go up there until the exam is over. Or I don't know if there's some conference rooms or whatever on the 3rd floor, but just please don't stand in front of the doors. If you come into the room after the assessment has started, you'll still be able to take the exam. So if, I don't know, say we start at 8:30 and you get there at 9, and we only have 60 minutes, then that means you have until 9:30 to finish. So please come in, get settled, be quiet in the process, and when you sign in is, when you're going to be able to have time. Well, your time starts from when you enter the room, but when the exam is over, it's over. I do have the program set to remind you of missing questions, and to remind you when there's like 5 minutes left. And there will be a timer. So I believe you can minimize the timer. So if the timer like weirds you out because it's counting down, then just minimize it. You don't have to use it. But because I've asked people to take watches off, I've enabled the timer in the program. So the details of the assessment. Now we're starting to get to the good stuff, right? So there's going to be 50 questions, but there will only be 49 possible points. 2 of the questions are worth 0.5. So 2 of the questions are worth half a point. All of the others are worth 1 point, hence 50 questions and 49 points. All of the questions are multiple choice. There are 2 questions that have more than one answer. So there's 2 questions that where there's more than one correct answer. We have covered all of the material on this assessment, all right? So there's nothing surprise, nothing, out of the blue. We've talked about everything. We've gone over everything. So I'm expecting everyone to just blow this out of the water and do extremely well. The questions there are a lot of application questions. And what do I mean by that? Remember, I told you that there's going to be some questions that you have to apply. So I may not say to you, what is the definition of cultural congruency, right? But I might describe a situation and ask you to tell me if it's cultural care, cultural congruency, if it's something else. All right. So we want application questions, because there are a lot of application questions on the nursing board. So you have the information. Settle down, relax, think about it. I want to know that you can apply it. Okay. Okay, so more assessment details. What kind of content is going to be on on this assessment? Well, there are going to be some questions that will you will be required to know regarding ethnicity versus race, right? So we talked about that. What's ethnicity and what's race? Race is more of a social construct, right? Um, so you would need to be able to determine those if they were, basically know the difference between ethnicity and race. The transcultural nursing model, that is David, I mean, uh, Geiger and David Heiser's theory or their model that they've put together to explain transcultural nursing. Remember that Leininger is the mother of transcultural nursing, right? She invented it, established it as a discipline within nursing, like it's ours, we own it. But then other people have come along and entered the work with her, and they've created other models um, Rachel Spector. We're gonna her stuff will not, Rachel Spector's models will not be on the test. We will cover them after, so they'll be on the next assessment that we have. But David Geiger and David Heiser will be on this assessment. So you need to know the transcultural model, right? So there's the nurse, and what does the nurse do? She has to do this assessment, which is a way of gathering information. And central to this, who does she get or he get the information from? The nurse gets the information from the patient. And then all of these 6 factors that sort of branch out in terms of communication and biological variations and environmental and social. So you'll need to know the transcultural nursing model, what are the components of the model, and be able to identify some of the, give examples or no, not necessarily give examples because you're not writing anything to me, but identify examples of, some social or environmental components of culture. You'll need to know what cultural competency is versus cultural congruency. And we've talked a lot about this in class. So, that being competent is having an understanding of your patient. But no one ever really gets there, right? Like no one's ever fully culturally competent, but we strive to become more and more competent all the time. But then, Leininger talked about cultural congruence. And that's basically understanding the patient, their culture, their cultural beliefs, and being able to meet them where they are. And so, there might be some cultures where they have some health practices and they may not make a lot of sense to us, but if they're not harmful and it's something that the patient will engage in, then certainly we need to be congruent at that time with the patient's culture so that we can help them. And Leininger gives a really good example of like having a woman available when a woman from a certain culture is going to have a baby, that, there may need to be certain people present and that the providers can't be men. And so rather than make a big fuss about this is the way it is in the policy and make this birth stressful, we can be congruent with what the patient needs. And it's easy. Usually in L&D and maternity, it's pretty easy to find female providers and to make this patient more, I guess, feel more safe in her environment so that she can have a safe birth. Okay, so that's like an example. There's if you need more examples, you can go back and listen to those interviews from Leininger that are in the PowerPoints. What are the components of communication? There's a slide, we've gone over that, right? You need to have a sender and you have to have a receiver and, the message. And so, what are those components of communication? Cultural variations regarding communication, certain body languages, just because a person from one culture looks away or doesn't look you in the eye doesn't mean that they're disrespectful or that they're shifty. And, the fact that Americans are kind of direct and we look people in the eye when we're talking to them and we don't look away, that can be perceived as being rude or disrespectful in other cultures. What are the implications of time? We spent time on that talking about it, as well as space. What are cultural implications of space? And then how do health beliefs affect the way we use and seek out health services, right? So we talked about the variations on religion. So I think Jehovah's Witness was the one that I gave an example of in class about people needing blood transfusions or, you know, um, other types of treatments. And if if a person, if it's against their religious belief, and religion is a big part of culture, right? So if it's against their beliefs, then who are we to say that they have to do something? As long as we've given, as the care provider, as long as we've presented them with clear facts on the pros and cons of accepting or denying blood, then the person can make an informed consent and their choices have to be respected. Now, if it's a child or someone who can't consent for themselves, like an elderly parent who's nonverbal or whatever, the parent might have a healthcare proxy or a living will. So that would help the family. But if it's a child or a minor, they're not able to consent. Remember, I told you about the people who are vegans, right? You can't make your 2-year-old a vegan and they have health implications because the 2-year-old really can't choose to be vegan. They can only eat what mom gives them, and it's incumbent upon the parents to feed them a meal that's going to be nutritious and beneficial for them at that time. Not to say that vegan diets aren't beneficial, but they're probably, if not done properly, babies can have a very difficult time, especially in terms of physical and mental development. So, what does health promotion mean? What is health utilization? What's health prevention and maintenance? So we talked about all of those things. There will be some questions about that. So there are some terms that we went over and we talked about. We talked about unconscious bias and how it could cause a person to discriminate, but it's not always, not everybody who has an unconscious bias discriminates outwardly. So what is the difference between discrimination? What is ethnocentrism? Ethnocentrism is when you think that people from your culture or your culture, whatever it is, if it's a dominant culture, meaning black, white, or if it's a culture versus heterosexuals versus gay and trans, or it could be old versus young, Army versus Navy, whatever the culture is, that yours is the best. So that's what ethnocentrism is. And then xenophobia, I believe this was mentioned, but it's like a fear of strangers. So sometimes people behave in a way that may seem to be discriminatory, but that's really not their primary intent. They're just fearful of other cultures or other people. What is cultural consistency? We've talked about that even though people might be here in the United States and they may have assimilated, they still may have some cultural consistency. So yes, I've taken on all the ways of my home country. So if I came from a Muslim country and now I'm here in the US, my children and I may celebrate Christmas and we might trick or treat and we might, go on Easter egg hunts and eat hamburgers and watch football games. So sort of becoming part of the culture and fitting in with the culture that, from where we've come to. And then cultural consistency isn't a bad thing or a good thing, but there's degrees of it, right? So someone may have high cultural consistency if they maybe they came from an African country and they're here in the US and they're getting along with everyone, but they prefer to go to an all African church where church is delivered in their native African tongue, where they only eat at African restaurants if they go out. Say I'm Nigerian, so I only go to Nigerian restaurants when I go out. I only buy Nigerian music. When I have opportunities to hang out, I'm only hanging out with other Nigerian people. I'm with, and I celebrate those cultural customs and holidays and other observances that are important to Nigerians, and I don't know what they are because I'm not Nigerian, but you kind of get the picture, right? Neologisms. And so what does that mean? I think we've beat that over the head, and everyone should know that that's right. A word that we have in one culture or one language, it doesn't translate to another language. Okay. So something like, and those are usually like brands, they can be places. Someone gave, I don't know why this keeps sticking in my head, but someone gave an example of like the RU screw, right? So if you were talking about that in German, like, and you said that, no one's going to know what that means. Like, it only has meaning to someone who is part of the Rutgers culture. Even here in the US, if you went someplace and you said it, it only has meaning to people who went to Rutgers, okay? So that's the neologism. And remember the lacuna is the space. It is the gap that is created. It's the word gap or the language gap that is formed when we have these neologisms. So you can go back and you can review lacuna and neologism. I wouldn't spend a ton of time on it. There's probably only one or two questions. So class, very important. You need to understand that. That's cultural and linguistically appropriate services. We spent some time on that lecture. What does it mean? What does it mean in terms of hospitals? And what are the implications for nurses and healthcare providers, right? And now, when Angelica was talking last week, she put up 3 lectures in her module. So she only had time to cover the first module. So don't worry about the last 2 modules. We will cover them, but they are not going to be on the test for Friday. All right. So you don't have to fret about that. Now you guys are probably asking, oh my gosh, what can I do? I want to do well. Remember, this is not a percentage grade. I mean, you can calculate a percentage, but it's all points. 50 questions, 49 points. That's it. So study. The best thing you can do to help yourself is to study. And I know people have been going over stuff and hopefully having those, impromptu questions sprinkled throughout the lectures is helping people to study. When you're taking the test, please read the entire question before you answer it. Make sure you read it, okay? Read the test question and then select your answer. Most of the questions only have one answer, but remember, some of them may have more than one answer. You'll want the best answer, unless there's something that cues you that, you need to select all, but in a situation type question, it'll generally say like, what is the best option for the nurse, or what is the best or most important? When you have those types of things in the words in the stem, that cues you that there's only one, one answer. So there may be a couple of correct answers, but which one is going to be more important? If I say, what factors, what factors influence obesity among children? Well, that's a question that STEM tells you that there could be possibly more than one answer. And so if I'm seeing a couple of right answers, I'm going to click both of those, okay? If you don't know a question, don't spend a lot of time, skip over it. Next year, you won't be able to do that, but this year you can, so take advantage of it. I allow people to ramp up, or if they need to slow down, okay? But the bottom line is you can go back and forth between your questions. And if you're going to change your questions, if you're going to change your answer, make sure that the answer that you're going to change it to is like 100% correct. You know, the rule is you usually go with your first thought and your first mind. So if you're going to change your answer, make sure that, okay, I know this is wrong and I know that the one I'm going to change it to is absolutely right. Because a lot of times people change their answers and what they had down first was correct. So, you know, little things like that can help you be successful. All right, so this is the end of the review. See, it's not so bad. Oh, I forgot to mention the articles. You will need to know health numeracy and health literacy, so that Gakumo article you should read because that's where most of that information comes from. And you'll need to know time perspective. So you were given something to read from Zimbardo. Basically, I'm interested in if you know the various perspectives of time. So like past positive, present hedonistic, present fatalistic, you know, that type of stuff. What does it mean and what does it mean in terms of nursing? And we went over those things in class. So now with that being said, if you have any questions at all, please, you can email me. I will answer your questions, but based on the assessments, the little mini assessments we've had in class and the discussions that we've had, I'm anticipating that everyone's going to do very, very well on this test. So get lots of rest, and I'll see you in class on Friday. Bye-bye.